Welcome, Denise Moudree.
Thank you. Thank you. I first came to one of the conferences in 2014, and that's when I met Cindy. And I hadn't been back until this year, and I can say that I am much improved since 2014. And I wanted, yes, and I wanted to bring an aspect of the patient, somebody who has Morgellons, who can talk to the patients about the experience. So never say whoa in a mud hole. This was a saying that was left in my desk when I inherited when I was working at the Department of Transportation in Montana. And it's one of the things that I have repeated to myself throughout my life, and certainly when I was going through my Morgellons treatment, was it's not the time to slow down, it's not the time to stop and give up, it's a time you have to keep going. I'm going to be showing a lot of pictures of mine here, and you'll see some familiar to you that have been shown previously here at the conference. So I've shared some with Ginger, and I've showed some with shared with Courtney also. So my diagnoses, I'll share with you what they are. Talk about, yes, it is Lyme disease. Some typical Lyme-related tests, and sometimes ones that can confuse us as patients. What Morgellons is not. Pictures of goop, guck, stuff, and fibers. How to remove the fibers from your skin, and how to know if your treatment is working. And of course, all of this is my opinion. So my diagnosis is Borrelia burgdorferi, Borrelia hermsii, Bartonella, and Babesia. And later on I'll show a couple of pictures of some of the skin scrapings. You can save those in a baggie and send those off to Igenics. I call it Igenics, Cindy calls it Igenex. But I think you know what we mean. So that can be tested for Borrelia and hermsii and Bartonella, and sometimes that's helpful in knowing what you do have. So when we talk about Lyme disease, and people say, but I was never bitten by a tick, and I would have sworn I hadn't been either. I was pretty lax about ticks. I grew up in the country in Montana, and ticks were around, but I just thought they were bothersome. I didn't think they could really make you sick. People say I didn't have a bullseye rash. My doctor says I do not have Lyme. My Western blot was negative for Lyme, or my CD57 shows I'm almost cured of Lyme, but I still have lesions. So when they say I've never been bitten by a tick, first of all, ticks don't bite. They kind of drill in to your skin. And they submit a substance that numbs your skin. So you're not supposed to feel them sticking in and drilling in and sucking your blood. So that's why a lot of people, and even the smallest one here is called a nymph, and it can be very infectious. The nymph, NYMPH. Bullseye rash. So many people may never develop, I don't remember a bullseye rash, but then bullseye rashes look a variety of ways. And there are people who've had, I've seen pictures of them, and they say, no, this isn't a bullseye rash. It's like, yes, it is. So it could be that we've had them, but we didn't recognize what they were. Western blot results. What it tests for. So when it does do a Western blot, people hear these things about bands. What the CDC positive means is that there are things that come back and it will list the numbers of certain bands, and that if you're CDC positive, you have at least 5 of these bands that are shown positive. And that's really basically an urban myth, and medical school, old school. That's the way they used to teach it. And some people get conflicting information from their doctors about IgG and IgM. And this is really, really oversimplifying it. But IgM typically shows a longer-term infection, and IgM typically shows a short-term infection. But that goes out the window when you have Lyme, because Lyme has been around for more than 5,000 years, as we talked about before. And it finds lots of ways around your immune system. It changes exterior protein, it changes shape, it confuses the immune system intentionally. I've read articles where Lyme can actually hide out in a lymph node. So the IgG, some doctors will say, well, unless you have IgG in there, then you don't have Lyme, even if you have bands that are showing. But that's not true. What the Western blot tests for, it does not look for the actual bacteria. It's looking for your body's immune response. And those of us with Morgellons can have a very low immune response for whatever reason. Could be we've had it for a long time, could be just our own immunity. There could be a lot of factors for this. If you have even one of these bands that's numbered, it can mean that you've been exposed to Lyme disease. I've had Lyme for decades, and I have just one band, number 39. And I have IgM antibodies. And so it shows that I've got a new infection, and I've had it for decades. First of all, we don't call it Lymes. It's just one of those little things. So there's a different Borrelia. When we talk about Lyme disease, you heard earlier some of the senso stricto and the senso lato. Primarily in the U.S., we test for Borrelia burgdorferi. And when you get a Western blot in the U.S., that's what it's keen towards, and only one strain of that. Now, if you were in Europe, they might be testing for the Vzelli or the Guarini. But there are people in the United States who have either the Vzelli or the Guarini, but they're shown as negative on the Western blot. Does not mean they don't have Lyme. It just can be a different type of Lyme. Other Borrelia, and this one doesn't show up on the Western blot, and that's the Hermsii, which is a relapsing fever, and that comes from a different kind of tick. So there are other ways of testing for Lyme, Borrelia burgdorferi, Vzelli, and others, other than a Western blot. It's not your only option. So for some of you who want to know for sure, do I have it? There are certain labs that specialize in tick-borne diseases. There are numerous ones of them. Igg and Igm is one of them. And this is one of the reasons why you need to have a Lyme literate doctor. So you can sit down and visit with them and discuss how you want to do your testing. So the actual skin scrapings for Morgellons lesions can be tested, and that's through Igg and Igm. I don't know if other places are doing that yet or not. The CD57. Sometimes Lyme literate professionals would check your CD57 or a CD57 plus to check and see how your treatment's doing. But and they could say, oh, yours is really coming up, you're really not that sick, I think you're gonna do fine. And it's going to go up and down throughout your treatment. So if you still have lesions, you still need to deal with it. For me personally, I'm waiting until I'm 6 months past having any lesions before I go off antibiotics, and to make sure that I'm past that time when it would be most likely to relapse and become more active. So answering the emails that come in, most of them, that come in to the Morgellons Disease Foundation, a lot of things what I hear from people is, I've got parasites or mites. These are all things that we know it's not. I'm not saying that people don't have these things. What I'm saying is this doesn't cause Morgellons. So cross-domain bacteria, columbella, Randy talked about that earlier, bugs, arthropods, spider nests, artillery fungus, crop circles, beetles, acne, rosacea, GMOs, chemtrails, dental adhesive, aliens, or nanotechnology. So the one diagnostic criteria, and you've been hearing this throughout the conference, is if you have lesions with fibers coming from them, you have Morgellons. Now, there's also, you can get a lot of lesions that come out, fibers that come out without lesions. And there are some people who never develop a lesion. And for myself, and you'll see some of the samples here coming up, I've had it both ways. I've had them coming out of samples, and I've had it coming out of my skin without any lesions. You really need the 60X. And this one is 60X, and so that's why I say that. I know Marianne mentioned before you can see it with a 50X, but this is the one that I'm familiar with, and you probably all have seen them over there where we had them for sale for $6 this time. This thing's really handy. Make sure you turn it off. Sometimes I put it away and the battery will get dead, but there's a little button along on the bottom that can kind of get knocked and it'll run your battery down. But it's excellent at being able to see things. So when we're talking about fibers, there's a lot of different ways that these can show up. You can see that they can come out bunched or they can come out more individually. This was one that suddenly I had this long thing. I'm like, where'd this thing come from? And I'm sure it was bundled up underneath. I know Marianne's talked about how they can bundle up. I'm sure that once it sprang through, it was kind of like, boing, and all of a sudden it was there. I will say that later I had lesions in that area. So the one on the left, I had problem with my cuticle, and I kind of tore at it. And it bled, and I put on a Band-Aid, and then all of a sudden I looked down there, and there's all these red fibers coming out of there. And the picture on the right, my feet itched for years before I ever heard of Morgellons. And after I realized I had Morgellons, I was someplace, and I had slip-on shoes, and I had the removable inside soles on there. And I took them out so I could wash my other shoes, part of the shoe. And underneath there, so underneath all my calluses there in the ball of my foot, this was underneath there. And I had two of them, one on each side of my foot. And it was just so gross just to go, oh my gosh, is that what's been collecting down there for goodness, who knows how long, with just all the fibers that were coming out of my calluses. Sometimes they're very sticky. This one on the left I'd actually pulled off. It was holding it with my finger there. But I was going somewhere and I kept seeing this sparkle over here. And I'm like, what is it? And it was just a very sticky fiber. The one on the right you can see is a much different type of fibrous thing that came from my ear. And this was coming out from underneath my arm. And I'll say that at the start of these here, these were ones that were really a sign that I was getting progressively worse. And I didn't realize at the time. I didn't know how to stop it at the time. But if you see a change in your fibers or the amount of fibers or the colors or things like that, you may want to talk with your healthcare provider and say, maybe we need to switch something up. This was after a shower. The other one was also, it seems like, the heat from the shower, and it opens up your pores, and it just makes everything easier to come out. Now here's some that are coming out of my finger, and there's no lesion. You can see that some of them are underneath the skin, and some of them are coming from up above. So this is one that I lent to Ginger, and she had used that in her book. And this was on January 18th of 2016. And this one came on May 18th of 2016. And it's a turquoise and white. At first I just thought I had something in there. I just kind of blew on it, and I was doing something else. I looked down, I'm like, and it's still there. So I took a quick picture, and then I went to pull it off, and I really had to tug on this to pull it out. So I didn't usually see ones like that. Sometimes they don't hurt at all coming out. Sometimes maybe something will tickle, but a lot of times the fibers could come out and I didn't really notice it. This one I noticed. It just jabbed out of my finger. Sometimes they come out with some goop, sticky substance. This one I removed with clear sticky tape. I found a packing tape. I was doing that for a while so I could see what in the world it was. Occasionally you might have some fibers that are fairly easy to see with the naked eye, and I had finally learned how to use my camera. I finally got enough past my brain fog that I could get things to focus and show up better too. And they, not just different colors, but they can look quite different also. And sometimes they're smooth, sometimes they're squirrely like this. And actually the one on the lower right, there's actually another little red one down at the bottom that kind of curls around the white one and comes out. This is one that was on my neck. Again, later on, sometime down the road, I did have a lesion in this area, but at the time, I just had the white and yellow stuff. You can see there's a red fiber in there also. Very different kind. This one was definitely tickling. I'm like, what in the world's going on? And I'd gotten to the point where I was trying to look in a mirror first before I just went, rubbing things off and saw that and took pictures of it. These were more like a blue-green tint to them and were kind of twisted fibers. Inside my mouth, I get these areas that are swollen, and they'll come from all the way back and it'll flare up. And I think that's when my Bartonella is flaring, I'm thinking. And I had taken a picture. I take a lot of pictures, and it's kind of my picture diary. And I can kind of keep track, and I would try to look at things. I started off with just a few folders. Now I've got a whole bunch of folders. It's like the mouth. It's like not just hands, but the left hand, and then the right hand, and the left upper arm, and the left lower arm. Because I was trying to track some of the symptoms that were showing up and to see what came first and if there was patterns to it. You can see there was a fiber inside this one that was under the skin. I only had a few like this. I can't tell you what kind of fiber it is, but it was fibrous. And on my scalp, little white ones that had they just kind of come out and get up to the top. Ginger, I believe, had talked about some of the fiber balls, and here's a couple of them. And I didn't have to go looking for these things. They usually showed up. There were times I'd go to wash my hands, and I'd look up in the mirror, and I'm going, oh, are you kidding me? Or sometimes just light, just happen to glance somewhere, and I'm going, what's that showing up? And I'm like, oh. So it's not like I went searching for them. Now, these are common things I found that can help to remove the fibers, because sometimes that helps to relieve the itching, and especially when you get to itching at night. So if you took a hot bath with Epsom salts right before bed, that can help to make it so you can get to sleep. Hydrogen peroxide using a Q-tip, like if I had in my ears, and I would get sores in my ears, and it would be so painful. And dousing that with a Q-tip with hydrogen peroxide first and putting that in there, and I could get some of those fibers out, and it didn't itch as much. And, pardon me? Probably 3%. And then with the, like a paper towel, my feet, like I mentioned before, I had those other fibers that had come out. And when they got to really itching me, I would put a paper towel, get it folded up, make it kind of wet with the hydrogen peroxide, stick it on my foot, and then put a sock over that so that it helped kind of keep drawing those out, and then it would stop that intense itching. lots of different kinds of stuff that comes out. And these aren't meant to alarm anyone or to scare anyone. It's to say, oh, somebody else had stuff like that. And so, because it's really quite freaky when these things happen to you. And you ask a doctor, and they're going, I don't know what that is. And you go, no, I don't know either. But this is just so that it kind of gives you an awareness of what can. And this is just my experience. Doesn't mean everybody that has Morgellons has it like this. It's not that at all. And Dr. Nicholas mentioned before about treating people for pain. And I am so glad he brought that up, because we are in a lot of pain. And even before we have lesions, we probably have pain. But once we start getting them and our body gets even more inflamed, and it's excruciating. Even taking a shower can be painful. Just oozed out. You can see in that top on the right-hand side there, you can see how wet it is underneath it. It was like, where did that one come from? But that's pretty much all the way these are. It's like, no clue what they are. This one's more of a harder red. It would come out, and I never saw them coming out. I'd see the after effect and find it there. I assume it's something reacting in the lymph system. Not too much of this with the orange and the black spots, but the orange was kind of new. This white and brown came out in different areas at different times, and I can't tell you what it means or what specific it is. I can tell you that this is one area where I did end up with a lesion starting, and it got pretty bad for a while. This one on the neck, I ended up with a lesion there too, and it was kind of like a clear white one there you can see, but it's like wrapped in all this goop along with it. So, I mean, there's only so many words you can come up with, right? Goop, stuff, guck. So the one on the left there was from one of my hands, and it was very greasy feeling. A little bit different than the one on the right, and I'm going to assume that they had something to do with lymphatic fluid, because nobody knew. Yes? I'm not a doctor and I'm not a scientist, and I really couldn't tell you. But biofilms, I just don't think it's a biofilm, because that's just something very, my impression of biofilms is they're much more, I'm sorry? No, it wasn't pus. Jelly, did you say? Gel? I've had clear. Yeah, but this is different. I'm sorry? The one on the left was, and you can kind of see up on the top part of it, it was very creamy. The lower part was a little bit more gelatin-like, a little more firm. Yeah, but this one on the right was just it was much more liquid. But this one looked gross and black. It was like, oh my God, I've got a worm or something. And I used a clear packing tape again and took it off. And you can tell it looks really much more just red and white when I got it up to the light. But I just took a piece of clear packing tape, put it over it, and pull it off. I'm sorry? Now this one on the left, I'm really quite certain that is lymphatic fluid, and I think it's kind of tinged with blood. It makes sense that our lymph system is being overwhelmed as infection spreads if we're not being on a treatment that's working for us. And later I'll share what I'm using, but there's so many different ways to treat this, and there is no one way. Like I use a lot of antibiotics, and there are people who can't use antibiotics at all. And yet we can all get better. But what you need to find out and what you need to do is work with your treatment provider to find out what works best for you. And at this time, I don't think I was having enough of the right kind. And one of the things I learned the hard way, and I know that for many people with Lyme disease, the way that they're treated with antibiotics is that they're rotated to different antibiotics so that they cover a lot of different forms of bacteria, and that you don't get resistant to anything. For me, I found that's when I got worse. I found that for me, being on this, what I found that worked, stay with it. So if you're making changes, I would recommend talk with your treating provider, but make changes slowly, and so that you can figure out what is working, what doesn't work. If you start to feel kind of better, maybe you need to change the dose, increase it a bit. But when some of these things happen, it probably means you're getting worse instead of better. I think, again, this was related to lymph. It was just bloody stuff that just would ooze out. Right. I think it depends on what's coming out. If you've gotten a lot of fibers that are suddenly coming out, that could be, but this was just different substances that I think were related more to lymph. I think that the infection was getting worse and my lymph wasn't able to keep up with it. So it was just coming out of the skin. My lymph nodes were getting clogged, and they created a dam kind of thing, and things leaked out kind of a thing. So I think it depends on what is getting worse. Not that everything can get worse, but to have more fibers and stuff. When I first started on antibiotics, and I didn't start with Dr. Day. I was somebody else at the time, and she said, "Okay, when you start on this, you're probably going to feel worse." And I looked at her like, "There's worse?" And she was right. I missed my next 3 appointments with her because I was too sick to get in. The herxing? The herx reactions that I had, and they may not be the same for everyone, the pain in my back was worse. I could barely move. I was nauseous. I was even more fatigued, and I just ached everywhere. I'm sorry? Pardon me? Well, does it hurt to pull out the fibers? Yes. When they're really embedded in there, yes. You're better just to let them come out. But one of the ways that, like using that hydrogen peroxide or other things like that, that it kind of seems to encourage them to come out on their own. And that seems to help, not to pull them, but they come out easier, my experience. I think that maybe the exception to that would be if you're taking a hot bath or a hot shower, because those kinds of things. Uh-huh. Mm. For me, I found that not all fibers were the same. Some of them came out quickly, some of them it's like, it's still there. I had one doctor say, well, when you see one underneath your skin, call me and come in and we'll dig it out. I'm like, well, I hope you're quick, because by the time I notice them coming out, they're not going to be there 15 minutes from now, so. Mm-hmm. Uh-huh. Yeah, the ones that I was showing when I was holding up, they were already just kind of coming out like the little balls, or the ones like in my hand that they were just, it was like the tail end of that, and so pulling those off. But when they were like in a lesion and they were definitely way down deep, those I couldn't pull out. So it really depended. Sorry, there isn't anyone.
Can we start saving some of the questions, writing them on cards? She's going to be part of the Q&A. We've got to keep this thing rolling.
Okay.
Thank you very much.
This kind of looks like an egg. Don't know what it is. It was just on my arm. You can see some more of that where it has some more little bloody stuff and some clear yellowish. And speaking of yellowish, this would come out. This wasn't uncommon. Things, and the one on the right was just, I could feel it coming out. You can tell there's some fibers in there, and I was just like, what is it now? And I found that this kind of yellow and reddish stuff was not uncommon either coming out. So you've seen some of these pictures coming up with my thumb, but this was kind of the series that happened. So on the left thumb, on the left side there, February 27th of 2014, this white substance came out, and March 4th that same year, so not quite a month later, then I had the spontaneous appearing scratches there. And then on April 22nd, this black tarry stuff that came out. And you can see I've got a tape there, and that was one that I used numerous times. It seemed like it helped to force the fibers out also. It was a waterproof tape that you can get for skin. And you can see there's something yellowish there. I couldn't tell you what it was. And I was trying to scrape off that tar-like blackness, but there wasn't any lesion there at the time. So on June 30th, looked down and happened to see this. I don't know how many times these happened, these feathery types of things. I really don't feel like they are feathers. There's something that's going on that's happening in the body that's maybe very minuscule, and suddenly it's becoming, in its own world, it's becoming a giant for some reason. Didn't hurt, it was just really odd. This one really kind of threw me. And this one. So again, I was reaching up for the light and I went, oh, something's coming out, and saw it. So when it was first coming out, it was kind of standing more upright. I thought it was odd because these little soft, spiky things were like pointed up. I thought that seemed weird. As it came out more, it's kind of starting to flop over. This is it from up above. So it doesn't really look like much unless you catch it from the side. More of the black stuff. So the black stuff comes in variety. We saw that tarry stuff. Here's the one that looks more like pepper just coming out. Flaky from the scalp. Just black along my cheek, and I did end up having quite an infection there. This was some of the first black that I had, July 2012, and I was outside doing some things, and I went inside, and both my right and my left arms were like that up here, and I ended up having lesions on both of these, and also a real fibrous feeling up in there, lumpy fibrous things that I think might have also been Bartonella related in addition to the Borrelia. This one was just fairly recently. I'm like, seriously? I thought we were done with this. And this came out after a shower. Don't know, but you can see there's a fiber there in the background. But I had similar stuff of the brown goop. It would come out either my neck, my hands, my arms, my legs. Sometimes I'd have white crystal formations. So here's some more of the scratches. That one on the left, that was one of the first ones. I was at work and I was on a computer. And I was minding my own business, and all of a sudden I went, ouch! And I looked down and I'm bleeding. And I'm like, and the guys came over and they go, what'd you do? And I said, nothing. I was just sitting right here. And it took still a long time from then. But the scratch, and doctors kept telling me, you're scratching yourself. I said, I'm not. I swear, I'm not doing that. And these look actually different. They actually start underneath and come up rather from the top down. I mean, if you actually scratched yourself on a nail or a piece of metal or whatever, that's going to scratch it from the top of your skin down. But these start from the bottom up. I don't know what to call these, except I call them tunnels. You have to come up with something to identify it. So you're going, all right, I'm going to categorize this. What does it look like? It looks like something went through there and it kind of collapsed this tunnel. So they're both on my left arm, but very different times. Here's my right forearm. So the one on the left there, August 9th of 2013, but the one on the right is now. And so what I can tell you is you can get better. And there was a time this was so painful and it's so embarrassing, and you're wondering, am I ever going to stop seeing those fibers? And am I ever going to be able to show my arms in public again, or my face, or whatever? You can get better. Had them on my lips. In fact, I just finally got rid of one on my lip. It was there quite a while, and I'd think I was done with it, and then it would come back up again, but it wouldn't ever be as bad the next times. So whether that was the persister cells or whether it was just different layers of the skin tissue, I don't know. But in this one on the right, the picture on the right, there's actually a fiber inside there, and I didn't know it at the time. And at some point, it seems like all of these lesions go through a bleeding time. And sometimes they'll bleed a lot like that. Sometimes they get like really sticky blood that doesn't run, but they all seem to, like, at some point, they go through a bleeding. I have a lot of them in my ears. I can still wake up sometimes in the morning and I'll have a little spot there that bled through. There are also ones inside. You can see the one on the right here. I don't know if you can see the fiber inside there. I think it's a fiber, not a hair. But the ones inside your ear, they just have such a wide range of pain reaction throughout your body that it's not like, you scrape your finger on something and it hurts there. With these, it's like it just hurts in such a wide area. You can see here that I was having them on my face at a time when I had no clue what it was, and how big and infected and reactive they can get. They can just look a whole lot of different ways. So there's no one look to Morgellons, from what I've experienced, and seen other people too, that you can't say, oh, that's exactly like a Morgellons one, because they look different at different times and different people. I called that my half and half chin. It was like, seriously? And here's my left hand at a time when it was. So they can happen all over your body. They can happen, you can see both of those pictures show them coming out of the nail and out at the end of the finger there too. Belly button, legs, ankles and feet, buttocks. So they can happen everywhere. They don't just happen on your arms or on your head or on your face or on your back. They can go, and I've seen where they affect some people primarily on their legs but nowhere else, or primarily on their arms but nowhere else, or scalp and nowhere else. And I can't tell you why that is. But some people get them everywhere. So rashes. Rashes come in a lot of different ways. I think the one on the left, with my leg there, I think that's more like a reaction to histamine. I told my doctor a long time ago, I said, I think I'm allergic to winter. That's when I was living in Montana. I said, I think I'm allergic to the cold, because sometimes that can start it. So I'm basically on antihistamines, the A1, and I'm also on the, or H1, and I'm also on H2 inhibitors. And that does seem to help. And this one on my chest was different than ones that I would typically get, and it came for a few days. Sometimes they're really quick. This one on the left was that Ginger showed earlier about Bartonella. And it didn't stay long. The one on the right there by my arm, it was just a very dramatic, you can see that line easily and I had that for almost a month. These welts are what, for me, seem to be indicative of Bartonella. And they would come and they would start to sting and burn and kind of itch, but more stinging and burning. And I'd often get nauseous and start vomiting. It didn't matter if I was driving down this road. It didn't matter if I was getting groceries. It would just hit and embarrassing. So some on the back there you can see on the one on the right there, there's some areas of hyperpigmentation too. So hyper and hypo both have happened. The reason I'm showing you all these back ones, I'm leading up to something. So I had it on my neck, I've had it more in the upper back, I've had it on the lower back, I've had it down low, right in the lumbar area. And as you can see, more welts like the Bartonella ones. So a year ago, this is what the surgery I had, that they put all this titanium. So all the things that you see there in the white is all titanium. And this is one of the things when you're not just trying to heal your lesions. With the Borrelia and the Bartonella, both of those things can really affect your back. And I think I would have always had some back issues, but I think having it for so long before I knew I had it and before I could get treatment, it made everything worse to the point where I had to have this major surgery. I'll carry this the rest of my life. And I really think it's important that you see a healthcare professional because it's very complex treating this. I mean, you've heard them talk that they don't treat each patient the exact same way. We're not little cookie cutters that you can go in and treat the same way. And you might have reactions to things that you don't recognize, or your treatment professional can say, I'm concerned about starting you on that yet. Let's try this. But if this happens, call me. So you really need to find one that you can work with. And I'm very blessed with Dr. Day. She listens to me and works with me. And I can say, well, you know, this is better, but can we tweak it some? Or let's just leave it alone this month and see where we go from it. But it really takes somebody that knows more than we do, who even the people who are trained in this are frustrated by treating it, and they know way more than we do. And I just really feel like it's not something to be casual about. It's very important for your overall health. If we can wait until the questions. Both. These are some of the other welts that I could get, some that look like scratch marks. One on the upper back and on my arm. So all the welts didn't all look the same, but they all tend to have the same effect. And they've gone away with my Bartonella treatment. I just get some now on my lower back. So you've seen this before on one of Courtney's, Dr. Day's, and this is how it started off on the left. So March 11th, and it didn't take long. March 28th, until it's starting to get a few lesions there and another scratch. And April 8th, it was starting to get very painful. And April 29th. By this time, it's like my arm, my breast, all the way down the left side, I was in agony with this pain. That's one of the scabs that came off one of the breast ones. You can see all the fibers in there. Again, the scratches. There was one on my knee, and I'd take a picture, and I'd zoom in, and I'd go, oh, there's a fiber, you know. And some more of the scratch or cracking or whatever you want to call it, and start bleeding. Even without fibers, that still happen. So this kind of starts some of my scalp. I'm trying to figure out where exactly it started for me, and I don't know, because there was a time I just kind of kept, you know, you just keep trying to get through a day, and you're going, what is this? Or what's starting on my scalp? Or why do my feet itch? Or why does this happen? And I can't really pinpoint a time exactly when these things happened. I know this. I moved to Oregon in 2008 from Montana, and I was sick before that, but I really wanted to move to Oregon, and I think the stress of moving, and my younger daughter kept getting sick every time I turned around, and starting a new job, and I think that we need to think about those things. They've addressed it earlier in the conference also, is that the triggers for you. And some people say, well, I got it when so-and-so moved in with me. It doesn't mean you got it from them. It could mean that you were just so stressed at that time, your immune system gets out of whack, and Lyme will take any kind of advantage it can of you. So as soon as your immune system goes down, it's like, we're off and running. So I think that had a great deal, and then not being able to get a doctor to treat it. I mean, we can all relate to how stressful that is. This was just a blob of a different kind of ooze that was coming out, and I wasn't trying to take a picture. I would just hold the camera like this, and I'd take a picture of them, and I'm like, what is up there? What's going on? This one was like, oh my goodness, it felt like my scalp was cracking open. And I went in, you can see where I'm poking that little spot there that's up above the scalp. I used my tweezers to pull it out, and so you can see how much of it was underneath the scalp at that time. I mean, it was just that little nub that was sitting above. Here it's like down at the bottom of the screen is like the back of my head and looking up forward there. And if you're thinking about cutting off all your hair because you think it'll help, it didn't. My hair was getting so wet at times, and I can't say that it was like that yellowish goop that came out or reddish or anything, but it was just some kind of maybe clear wet stuff that would come out. And I had no idea why. And then I would go to doctors and they'd say, well, I don't see any of your lesions. I'm like, well, they're there. And that was kind of one of the reasons why I did it. I wouldn't do it again. And you see here, I could feel burning, and I could feel something swollen up there, and you can kind of see how that was swollen and was making some, I'm sure it was lymph fluid of some sort. 2 minutes? Okay, wrap it up. All right, I'll go quickly. So you can kind of see the progression and some of the white fibers that came out and brushing. These are all signs of things getting worse. This is what it looks when it got worse. And this is extremely painful, and this is one of the reasons why you have somebody that can treat you for pain. The scalp does go very slowly. It also, like at this stage, it feels like acid's burning up out of your skin from the inside out. Sometimes people look at these things and they say there's teeth on them. It's like, it's not teeth. I think this is what Marianne called the, what do we call them, Marianne? Follicular cast. And those have black things in there are hairs that are actually growing down and not up. There's another one of them. And you can see here on the left hand before I scraped that off, and on the right side where it was. And now I basically have two. I have one over here and one on the right, back on the right. But I still have a lot of scalp swelling up there. And you can see here, left hand, when I had the lesions, and now So I still have the ACA there that you can see that Dr. Nicholas brought up. So I don't have lesions, but I still have inflammation going on. And some of the things that help me, this is fairly inexpensive things, is what I'm mentioning here. The Cetaphil Gentle Skin, the cleanser, not the lotion. And you can put that on anything that's like scalp things, especially that are burning, but any of them, and just, you can leave it on. You don't have to wash it off until you want to take a shower or whatever. For me, I found that this Dermarest eczema helped the itchy. You can't always find it, but you can find it on Smile Amazon. And speaking of Smile Amazon, please use Smile Amazon, and using the Charles E. Holman as your nonprofit choice. And the Nioxin, you can also get that on Smile Amazon, and I do feel like it has helped. How do you know it's not, whether it's working or not? For me, if I changed antibiotics and immediately became worse. When I went off Bactrim, I'd immediately get worse, and I couldn't sleep, I was crying, I was in pain. Everybody with Morgellons, it takes a long time to get better. The whole point is, are you not getting worse? And as you go through treating one thing, you may find that other symptoms then flare, and you have other things to deal with. It's not that you're necessarily getting worse, it's just other things are coming forward. These are the things that I use, but some of the things here that I find are really helpful is taking NIC. If you are taking antibiotics, it's especially helpful. It helps to protect your mitochondria, so it helps with your energy, it helps with detox. And taurine can also help with energy. And if you're herxing, don't stop. And talk to your doctor before you do, because it's usually a good sign that if you're herxing. And please remember to register at the morgellonsglobaldata.com so we can all be heard and start gathering more data about Morgellons. Thank you.